I'm Brittany Lewis with Forbes Breaking News. Senator Rick Scott sounded off on the economy during Thursday's Senate Budget Committee hearing. Scott blamed rising costs on, quote, the socialist agenda that the Democrats are pushing. His remarks come as April's Consumer Price Index report showed that the rate of inflation slowed for the first time in 8 months. Here's more from the Florida Republican.
I want to thank everybody for being here today. You know, I grew up in a country where a kid like me, growing up in public housing, born to a single mom, could go out and try anything because it was a capitalist system that created opportunities for us. We had to get a good education. You had to work hard. I mean, I started working at 7. My family, we all worked hard, and we were able to achieve the dream. Right now, if you look at what's going on in this country right now, let's look at where the economy is right now. Today, PPI numbers came out, 11%. Look at the inflation numbers up, over 8%. Look at our GDP, it's negative. You can't think about it. In the United States of America, you can't get baby formula if you're a young mom. I've talked to young moms that had to drive around all weekend last week and try to get baby formula for their kids. So we have a supply chain crisis. We've got interest rates going up. We got the stock market going down. So this socialist agenda that the Democrats are pushing, it's not working. You can't spend money you don't have. We have $30 trillion of debt. Medicare is going bankrupt. Social Security is going bankrupt. We're not pre-funding any programs in this country. There was a bill that got passed that put Medicare actually in a worse position. We moved retiree benefits from the Postal Service to Medicare when we know Medicare is not funded. So now we're talking about Medicare for All, which I think it ought to be called Medicare for None. The bill that we're talking about today will abolish the current Medicare. Here's what we're talking about. Abolish the current Medicare program and make private insurance illegal. Think about that. The goal is to make private insurance illegal. They don't want to widely expand government. They want to make it illegal to have your private health insurance. We ought to just all read the bill and understand exactly what's happened. So the horrible proposal will ruin the Medicare program because right now, as you know, it's not funded, right? And we're running $1 trillion+ deficits. The Biden agenda takes our debt to $45 trillion. Tell me how we're going to pay the interest expense on what we already have. It's going to throw 150 million people off the private insurance program. Over 24 million people have Medicare Advantage programs, which they like because they get additional benefits. That's gone. According to independent estimates, it will cost upwards of $30 trillion over the next 10 years. I don't know where the money is coming from. So, one, it makes private insurance illegal. It lets government decide what procedures you get, when you get to have them, which ones are covered, which ones you get to have. You want the government to make these choices for you. It pays doctors less, healthcare workers significantly less. We already have a worker shortage. You pay people less, guess what? You're going to get fewer of them. So if you care about healthcare for this country, it doesn't make any sense at all. So, Ms. Turner, advocates of Medicare for All keep using UK and Canada as examples of great socialized healthcare. Can you talk about the problems of wait times in the UK or Canada and how it impacts somebody's individual health?
Well, and as you say, because of a resource shortage, people wind up with long waiting times. The Fraser Institute in Canada has been studying wait times for 30 years. When they started, the average wait time from seeing a practitioner to getting referred to a specialist and getting your treatment was about 9 weeks. It's now 26 weeks, half a year, and in some areas it's a year. In the UK has so many people on waiting lists for care that the UK Health Secretary says if you spent more than 18 months on the waiting list, then you can go to a private payer in order to get care. But it's not just there. Any place where you see resource constraints, and that's absolutely what will have to happen with the government-run healthcare system. In California, health officials just announced that fines for $55 million, Mr. Padilla's home state, the Los Angeles County government, for low-income residents treatment plan. they found that people were having to wait an average of 90 days, which is 6 times longer than the 15-day limit. So it happens anywhere that you have global budgets and resource constraints and are not able to pay enough people and not have enough facilities to provide the care. Universal coverage does not mean universal care.
No, you don't get it. So take the UK. If you're rich, do you have to go through the UK system? No, there's a separate system. For the rich, they can go to private hospitals. Right. So if you're poor, you have to wait. Wait if you get the care in time to stay alive. Right. But if you're rich, you can either go to the UK or you actually come to the United States, which like a lot of Canadians come to the United States. Right. So I mean, what this will do is, if you want care for everybody, this will mean you'll get way less care for people, and you'll wait longer for your care. Thank you.
Thank you, Senator Scott. Welcome back, Chairman Sanders.